Module Overview. The proper handling, cleaning, and disposal of medical equipment, linens, and healthcare waste is a core component of infection prevention and control IPC systems. Improper management of these materials can lead to cross-contamination, healthcare-associated infections, HAIs, occupational hazards, and environmental contamination. In the post-COVID era, there is a heightened emphasis on infection-proof logistics, enhanced disinfection protocols, PPE usage during material handling, and strict segregation of infectious and non-infectious waste. This module deeply examines the theoretical frameworks, practical handling procedures, risk reduction strategies, and compliance protocols essential for meeting international accreditation standards such as WHO IPC Core Components, CDC guidelines, OSHA standards, and national environmental health frameworks, e.g., UK's HTM 07-01, Canada's biomedical waste regulations. 1. Medical equipment classification and risk levels. Medical equipment must be handled differently based on its risk category. Spalding classification system, risk level description. Examples: required reprocessing. Critical penetrate sterile tissues or bloodstream scalpels, catheters, implants. Sterilization, semi-critical contacts, mucous membranes, endoscopes, thermometers, laryngoscopes. High-level disinfection, non-critical contacts, intact skin, only stethoscopes, blood pressure cuffs, cleaning or low-level disinfection. Post-COVID guidance now emphasizes higher-level disinfection for semi-critical tools and frequent reprocessing of even non-critical tools due to aerosol risks. 2. Cleaning, disinfection, and sterilization protocols. A. Cleaning. First step. Physically remove soil and organic material using detergents and water. Essential before disinfection or sterilization. Use brushes, wipes, or ultrasonic cleaners. B. Disinfection. Eliminates most pathogenic microorganisms, not spores. Disinfectants used: alcohol, 70%, for small instruments. Sodium hypochlorite, 0.1 to 0.5%. Hydrogen peroxide for semi-critical tools. C. Sterilization. Destroys all microorganisms, including spores. Methods: steam autoclaving, 121 to 134 degrees Celsius. Ethylene oxide gas, ETO, hydrogen peroxide plasma, dry heat. 3. Handling and processing of linens. Risk associated with soiled linens can harbor MRSA, C. difficile, norovirus, COVID-19, fungal spores. Aerosolization during shaking spreading increases risk. Safe handling guidelines. Use gloves and aprons when handling used linens. Never shake linens in the air. Place directly into leak-proof color-coded laundry bags. Use hot water cycles, 60 to 90 degrees Celsius, for laundering. Use bleach-based detergents if available dry, completely using commercial dryers. Heat kills pathogens. Post-COVID update. Disposable linens introduced in isolation wards. Higher laundering temperatures mandated for all healthcare facilities. 4. Healthcare waste management and segregation. Types of healthcare waste. Waste category. Examples: color code, WHO UK standard. Treatment method: infectious waste, blood-soaked dressings, swabs, yellow/red autoclave or incineration sharps. Waste needles, blades yellow with rigid sharps bin. Incineration pharmaceutical waste, expired drugs. Vaccines, blue return to pharmacy, incinerate. Anatomical waste organs, tissues, red bag plus rigid container. Incineration. General waste paper, packaging black/green landfill, or recycling segregation must be done at point of generation, and containers must be clearly labeled, leak-proof, and covered. 5. Regulatory compliance and staff responsibilities. Global standards. Met in this module, WHO Core Component. 8. Built environment, materials, and equipment, CDC Environmental Infection Control Guidelines. OSHA Bloodborne Pathogens, Standard NHS, HTM 07-01, Management and Disposal of Healthcare Waste. Public Health Agency of Canada, HC Waste Management Guidelines. Staff responsibilities: report damaged or missing containers. Attend mandatory IPC training annually. Maintain a clean and organized workstation. Use PPE during all handling and disposal processes. Ensure all reusable items go through reprocessing. 6. Innovations in automation in handling and disposal. Washer disinfectors for reusable tools. automated vacuum laundry systems, hands-free sharps containers, RFID tagging for medical equipment, tracking smart bins with overflow and contamination alerts. Learning outcomes, Module 6. By the end of this module, you will be able to identify the different types of medical equipment and match them with correct reprocessing methods, apply evidence-based cleaning and sterilization techniques, safely handle and launder used healthcare linens, correctly segregate and dispose of healthcare waste based on color codes and risk levels, understand the regulatory framework and staff responsibilities for IPC compliance,